Alright, this is my audience. It's Ronnie York, Karen York, Sheila Ferguson, Carl Ferguson, and Bobby Jones. And as my prop is Lucas Thacker. How many people in here know what CPR stands for? How many people in here know how to perform CPR? Okay, CPR stands for cardiopulmonary resuscitation, also known as mouth-to-mouth. There are 6 things in CPR that you need to remember. It is your ABC and your 1, 2, 3. A stands for airway, B stands for breathing, and C stands for circulation. For your 1, 2, 3s, 1 stands for check the scene, 2 stands for check the victim, and 3 stands for call for help. CPR can restore circulation to the brain. According to American Heart Association, brain death starts to occur 4 to 6 minutes if CPR is not performed. According to American Heart Association, approximately 94% of sudden death victims die before reaching the hospital. According to a medical consultant, cardiac arrest victims' chances of survival fall from 7 to 10% for every minute CPR is not performed. Your CPR steps are first you're going to check the scene. You're checking the scene to make sure that it's safe for you and for the victim, because you don't want to put yourself in harm while giving CPR. Then you're going to have someone to call for help if there's someone around. Then you will check for breathing and consciousness of person. You will check consciousness by putting your hand on their shoulder and gently shaking, asking if they are okay. You will check breathing by putting your ear to their mouth and looking down chest for the rising and falling of their chest. Then you will do the head tilt chin lift by putting a hand on the forehead and a hand on the chin and tilting the head to get an airway so you can breathe into their lungs. Once you have the head tilt chin lift, you will then begin CPR. You start CPR by pressing the nose or pinching the nose, and you will give 2 breaths, 1 second apart. After you give the 2 breaths, you do the 30 compressions, and you will do those with your hands overlapped and interlocked, and your arms will be locked, and you will be in a rocking position. Now that you know some basic information on CPR, I'm going to demonstrate how to perform CPR. You will check the scene to make sure it's safe. You will call 911. Then you will check the victim for consciousness and for external bleeding. So I'm going to check for consciousness by shaking him lightly and asking, "Are you okay? Are you okay?" He does not respond, so then you are going to check for signs of breathing. You will do this by getting the mouth open and putting your ear down to their mouth and looking down the chest for rising and falling. Okay, he is not breathing, so then you will do the head chin tilt by one hand on the forehead, the other hand at the chin, and you will tilt the head. You will want it at an angle that you know you can get air to their lungs. So after you do this, you will give the 2 breaths, 1 second apart. Then you go to the chest, and you want to go 2 inches down, which usually puts it between the breasts. You will have your fingers locked and your arms locked, and you will be up on your knees, and you're in a rocking position, and you do 30 compressions. And once you have that, you do the CPR until emergency personnel arrive. I have told you the basic information about CPR, how it affects our lives, and I have shown you the steps and demonstrated the steps of how to do CPR. I hope you have a better understanding of how to perform CPR and are more confident in helping a person in need. Thank you. And is there any questions? Yes.
Why do you pinch the nose?
You pinch the nose so that when you are giving the air, you are breathing, the air goes into the lungs instead of out the nose. Good question. Is there any more? Okay, thank you.